Welcome to the Bill Walton Show, featuring conversations with leaders, entrepreneurs, artists, and thinkers. Fresh perspectives on money, culture, politics, and human flourishing. Interesting people, interesting things.
Welcome to the Bill Walton Show. Unfortunately, we're taping this show in a terrible time for the country. We've had the pandemic virus affecting our country and countries all over the world, and the economy shut down. And I think one of the things that we're missing are essential freedoms as part of addressing what's going on with this virus, shutting down business, shutting down the right to assemble. That did have me turning to the Bill of Rights and to the Declaration of Independence. And you look at freedom of religion, freedom of press, freedom to petition government, things like that. The cornerstones of what has made America great are definitely under threat as we speak. And from Thomas Jefferson, we have our right to pursue life, liberty, and the pursuit of happiness. But it seems like in the pursuit of life, which is an existentially important thing to do, we seem to have forgotten the other two aspects of the Declaration, which is liberty and the pursuit of happiness. With me in the cause of freedom, fellow travelers, fellow warriors are Lawson Bader and Tracie Sharp. Lawson's chairman or CEO of the DonorsTrust, which is an organization which steers donor money to highly promising conservative and libertarian nonprofit groups throughout the country and in some cases around the world. Tracie Sharp is doing very important work as the chairman or the CEO of the State Policy Network, and in that she works with think tanks and action tanks throughout the country in all 50 states and really has her eye and ear to the ground to let us know how everybody's being affected by this current situation. Together, they've come together to create something that's called the Growth and Resilience Project, which I think is a terrific idea for today's issues. And with that, I'd like to kick it off and let's pick ladies first. Tracie, tell us about the Growth and Resilience Project.
Well, this came out of the need from the coronavirus crisis that we're all in. And a lot of this is being addressed through direct policy, especially at the state and local level. We know that in the first few weeks, the moves that were made by governors to open up healthcare access, these were public policy moves, most of which came from this network of think tanks around the country, at least one in every state, to help increase access, which these changes help save lives. Out of that success, we knew that eventually we would need to get this economy going again. And out of that came the Growth and Resiliency Project, that working with DonorsTrust to bring together investors and donors and people of influence who care about saving lives, keeping people safe and healthy. And a big part of that is getting this economy going again. So I was pleased when Lawson Bader of DonorsTrust came up with the idea, gave us a call, and we got it launched very quickly.
But philosophically, the thing that distinguishes this that I think is so important is it's civil society solutions to today's problems. It's people organizing themselves locally to address problems as they happen locally and fix them. And it doesn't involve a government determining outcomes or actions. Lawson?
Correct. Yes.
No, that's exactly right, Bill. I think it's, obviously DonorsTrust represents sort of the philanthropic community in all of this. And it's important to remember that obviously this whole thing started with the health crisis, a legitimate one. And whenever we have crises across the country, be they hurricanes, earthquakes, famine, donors, philanthropy is always quick to step up and help. And we certainly have seen that happening when it comes to sort of the medical need. And the problem is a health crisis precipitated an economic crisis. And it's actually the reactions of largely governors, elected officials, well-intentioned or not, that have now put us in a different kind of a world where the response actually requires the right kind of policy response. Because if we don't get that right, we won't be in a position to actually make some of the advances in health that have happened. And so the idea of the project was to come along with our donors, to partner with the groups like the State Policy Network, the Atlas Network, which also represents sort of the global think tank free market community, and to focus on some quick solutions to address regulatory barriers, to get people back to work, to focus on sort of health access, to look at some of the sort of the ridiculous rules out there affecting who can have what. So there are accounting rules, for example, that don't allow certain or penalize certain businesses for stockpiling medical supplies. Well, seems counterintuitive at the moment. So we have to think of this as the commonsensical approach to address some of these regulatory issues so that we can actually get change, food back in the process and all the distribution processes going, and get some common sense thinking to how people actually organize and go back to retail stores, because that's where the devastation has occurred. So if we can partner to turn this economic crisis into some resilience and use the think tank community, both national and state, that's where we want to do it.
Well, common sense involves doing what's necessary where it's necessary. And Tracie, the virus has disproportionately affected some states, but not many others. Can you give us a profile of where this is a big problem and where not so much?
Well, we do know, obviously, that California and New York have been deeply affected, and but every state in some way has been affected. And this is why it's important that we allow each state to see proximity in policy matters, which is why the policies put forth that are specially designed to help each state, it's better to try to solve these issues at the state level. See, a lot of what Lawson was talking about, and really at our core beliefs, is that we believe in private voluntary solutions to help mitigate human suffering. And what happened in the first couple of weeks to increase access came from market-oriented ideas that were private and voluntary, and having philanthropy come in to help, having policymakers at the local level infused with these ideas where it's relevant and responsive to the needs of the people in those states.
What's an example of some of those?
Well, for healthcare access, it was a removal of certificate of need laws, which this is going to be an oversimplification, but allows for equipment to move more freely and access to equipment. It's expanding telehealth. It's expanding the scope of practice, which lets medical professionals work at the top of their field, and removing requirements around licensing. Of course, we keep in mind, front of mind, the health and safety of the patients. But with executive orders, stroke of the pens, that these were put in place, these barriers to health access were removed. And as a result, lives were saved. You know, when the governors of Colorado and Michigan are picking up state think tank ideas, these market-oriented ideas, that we really want to make these temporary changes permanent, because the patient, average Americans, benefit.
Well, I wish the governor of Michigan would take up more of your ideas.
Well, yeah, we're working on that.
She's become notorious.
Yes.
She's determined our power tools we want to buy at Home Depot are non-essential. Maybe she's right, maybe not. I think
I do love
Lawson?
but my opinion is it's got the greatest banner, but no seed, but you can get weed. So
yeah.
So what are some of the projects that you've supported? I see your Competitive Enterprise Institute's one of them, Lincoln Network's another. Want to talk about what you're trying to do?
Exactly. So what we've done is sort of come up with an initial pool of resources. We've started to advertise, go ahead and submit things and try to come up with some fairly clear and narrow definitions of what we're looking for, ideas of economic deregulation, reducing barriers to entry, employment, and also, frankly, countering the narrative of the Michigan governor, among others. And so we had the first round come in. We have funded 5 initially. The Competitive Enterprise Institute has a project called Never Needed, which is the hashtag Never Needed, sort of looking at the campaign for why did we even have that rule in the first place. This is a scalable idea. So CEI can help run it, but frankly, it can flow to the SPN networks and Atlas networks. And so it's replicable. We funded a project actually in Indonesia because we're looking globally at this, because this is a global issue at the moment. And there are some barriers to food production actually that have been caused by some government rules. And so the organization there is looking at an opportunity to actually reduce those, to see a free flow of food and beverages into Indonesia, which is needed at the moment. The Lincoln Network, looking at working with some professors to develop a better statistical model for how we sort of analyze risk and what actually is the data that we're seeing specifically related to the COVID-19. The National Taxpayers Union Foundation is a fourth project. They're looking at some of the nitty-gritty that we wouldn't think of, but how tax filing status is going to change. Loosening flexible spending accounts, for example, the rules that govern that. Telework paperwork is a whole issue that none of us really thought was a big deal 2 months ago, but the reality is that many of us are teleworking at the moment. And then the Mercatus Center has a sort of free market education online project. So each of those is sort of looking at a piece of that. We literally have 22 proposals right now that we're looking through, and another 5 or 10 on the way. So we're just trying to find the broadest ones that apply in a way that can be scalable, can be utilized right now, and that frankly, by us doing this, we're hoping that other donors and other organizations see value and come alongside and support those efforts.
Where would I find the never? I'd like a list of never needed regulations. Where is that on the CEI website already?
Contact CEI for that. We have created a website at DonorsTrust which defines the project and lists the organizations that have been already sort of granted, but CEI would be where I would go to see that. They're looking at, so like one of the ones is looking at how the FCC, for example, has made some changes that now make it difficult to telemedicine and the spectrum allocation, how that's distorted things at a time when we need a lot of spectrum use.
Is there a silver lining to all this crisis, and that we might see that as the smoke clears and we come up for air and we get back to work and things, that more people are looking at some of these regulatory constraints or barriers in a way to say it's now time to get rid of them?
I think that's the hope. The fact that you have a lot of eye rolling right now over, I'm sure just as many supporters of the Michigan governor are thinking, really, you can't buy houseplants to go outside and plant? And how do you turn that confusion, which is not an ideological reaction, into an opportunity? I'm sure some of your listeners know the Overton window, the idea that politicians are going to respond to what is perceived as popular. Well, if some of these things can be shown to be ludicrous and unnecessary, and as Tracie said, actually affecting lives, you start to shift that to opportunities. And what used to be considered a bad word like deregulation now becomes a much more commonsensical approach. So frankly, we can avoid this happening again.
The Overton window is the idea that you've got certain ideas that are so outside the pale, outside the bound, they couldn't be in the window, never consider them. And then there's something that we'd consider radical that if you start looking at it freshly, it gets more realistic. And eventually these ideas work their way through into policy. Is that essentially?
That's exactly right.
Right.
Yeah.
We think we have that opportunity in the States, that there's a gap, an opportunity that's opened up to move that Overton window of what's politically possible. A lot in healthcare access, but now as we try to get the economy started again, to help states meet their budgets, they will all have budget shortfalls. And so the state groups are activating to move that Overton window at this time.
Now, do you also do the rich state, poor state study? Or is that
Alex work?
Yeah, that's because this is also an opportunity to see what works and what doesn't work. Right. On one end of the spectrum, you've got the Michigan governor, and the other end, you've got, is it the North Dakota or South Dakota governor that has a completely different take on it? Can we hope we can draw some conclusions about how a state government ought to act like in a circumstance like this?
No, I think that's exactly right. I certainly think there are some fiscal decisions being made right now in Ohio and Maryland and other states that saying, look, we're going to freeze all clearly COVID-19 related spending, and you're not getting the legislative pushback that one would normally have, because I think people realize that state budgets are in trouble, and the last thing a state's going to do right now is raise taxes. And so you're getting some of that spending, cutting, fiscal responsibility that may not have been there otherwise, and that becomes an opportunity. And as other governors see success of others, then they're going to mimic that accordingly.
Yeah.
Tracie?
The states that are more successful in handling this are going to become models. So we're looking forward to really amplifying those successes, to really trying to spread them to other states and give credit where credit is due. And I think this is something that the network is pushing for, because these are experiments in these states that can be held up as success stories.
How do you, DonorsTrust? I mean, everybody's under pressure now with their contribution dollars. Everybody's portfolios shrunk by 10, 20, 30, 40% in some cases. How do you see that affecting your ability to make these good ideas happen?
Well, in part, we actually created this fund in part because of that. The reality is there are lots of donors in different situations, as you say. Some who give out of their annual income, for example, where they have jobs that are not seen as necessarily at risk, may or may not have any effect on their ability to. Others, where it's a portfolio based, that decision may not be made until December, and even then it may be till later. The challenge is finding, in a midst when probably a lot of donors are getting a lot of emails and a lot of phone calls, and I understand why, we want to create this to at least allows a decision matrix. So there's two things. One, I originally put it together with Tracie and Brad Lips, the head of the Atlas Network, and Adam Meyerson, who's the soon-to-be outgoing president of the Philanthropy Roundtable, then Kim Dennis, who runs the Civil Freedom Trust. And the idea of having those five is that they represent a lot of organizations. And so for some individuals who say, I've got limited dollars, I've got limited time, I'm getting a lot of requests for things, and I know I want to do something, can I maybe use this fund either to give you a grant and you can make the decision, or you can see what we're recommending and you can come alongside and partner. So we're trying to make.
Well, yeah, to be clear, the reason I was excited to have you two on is that you both probably have some of the best windows into what's working and what isn't working throughout the states, in Tracie's case, and throughout all sorts of different nonprofit think tanks and action tanks. In your case, Lawson, I mean, one of the resources you bring to bear is what organizations have actually been effective in the past, and what do we think is going to be effective now? You want to amplify?
Yeah, I mean, the challenge is that this is obviously a competition for dollars, and truth of the matter is competition also forces people to innovate and be effective. And at the moment, we need to have the groups that are best able to respond be the ones that are supported. No disrespect intended to those that are maybe not as well positioned, but that's the reality at the moment. And so but the thing is, there's a national and a state approach here. I mean, some of the things simply have to be done at the federal level. That probably will involve more of the DC-based think tank world, but yet the implementation at the state level is going to be an SPN and Atlas, and we want those to push up, so there's pressure coming from different ways. But the donors, of course, feel differently. Some are very passionate about the civil rights issue right now. Some are being more passionate about the sort of deregulatory efforts in employment law in their own state. We want to provide resources that they can make the best decision, but we also do want to make recommendations and highlight those groups that we think are in the best position to sort of make the bang for the buck. And if that's the case, then those should be supported.
So Tracie, you have organizations representing almost 120 million in annual revenue, and what is it, 150 groups? How are they? Can you give us some flavors about what categories do you think are being especially effective?
Certainly in healthcare access, where they can show market benefits can directly alleviate human suffering. Also, now they're pivoting quite powerfully to when the economy gets started again. And that is specifically to help state budget shortfalls by reprioritizing government spending. And these hiring freezes is part of that. Providing tax relief for American families and businesses. And thirdly, cutting red tape to provide certainty and encourage innovation. this is the backbone of a lot of this fiscal policy work that this network is so strong at. And a gap and opportunities opened up for us to charge in and help these policymakers with these ideas to make ends meet and to help the people of their states. I mean, we do believe there's a federal and a state component. Of course, we work predominantly in the states, and now is our opportunity to really move this forward. And these groups for years have been set up for such a time as this.
So how would we find you to find out what kind of project? If I'm running a nonprofit and I want to reach out to you, how do we make that happen? And secondly, if I'm a donor, how do I look at the opportunity set? And I guess the third related question is, I'm a donor, do I contribute to specific projects, or is it a pool of money that goes into what the committee decides? How does that work?
I'll answer all three questions in three ways. If you are an organization that is interested in applying, sending us a proposal, we actually have a dedicated email, resilience@donorstrust.org, or just go to the Donors Trust website and you'll see where there's a link to the page, and you can submit something that way. And that page also has some of the requirements and details. If you are a donor who is interested in learning more about those projects, we have made all the projects that so far have received grants, and we'll update that in shortly. They're all there, so you can go to the DonorsTrust.org resilience page, and there's a list of them all. You can obviously contact me directly. Third thing about how do you help? Well, there's two ways. We certainly, because it's a project at Donors Trust, and Donors Trust itself is a donor advised fund provider, but we are a charitable organization. Contributions can be made directly to the fund in various ways. If, however, you really are interested in sort of picking one of the projects that we have funded and coming alongside, just talk to me and I can help you guide that through. Again, my interest here is putting some money quickly into scalable projects that are going to have an impact, but to use this project to try to, frankly, prime giving from other sources to those same projects, so that we can sort of help begin to push the rock. The rock will continue to roll, and donors will be able to come alongside. So anyway, I hope I answered it.
Tracie, yes, you answered it in three ways, maybe more. Tracie, well, there are five of you on the committee deciding how you want to deploy capital. How do you decide which projects have the highest priority?
Well, I think as Lawson had said, whether it's scalable, whether it directly addresses a need right now, especially to mitigate suffering, and whether it can be replicated in other states. I think there's over 100 of these kind of solution ideas on the State Policy Network website. That's spn.org, and then /coronavirus will give you even more drill down listing. But what the Growth and Resilience Project is trying to do is to get these moving more quickly with investment and quick infusion of capital to amplify what has already worked and bring more of what's working to the fore. Lawson, is that how you would characterize that?
Exactly right. And foundations are notorious for taking their time. And frankly, one of the reasons why we have done this is because private foundations are slower, and we're going to need them for some long-term issues. We're able to respond quickly. So our hope is that every week we're actually making a financial decision, and that money is being made available to that organization almost the day of the grant. So we're a very quick moving group. But we do look at the scalability. We look at the ability of other groups to mimic. That's important. And ultimately the success, and again, sort of a broad approach. So we do want to focus on education, but we do want to focus on pushing back on a larger narrative of how do governments respond in a crisis, and what does that mean for the future, as well as very specific issues of telemedicine and whatnot. And the more we can do that, then I think we'll have that broad seed approach, which is what we need right now.
One of the things, one of the silver linings to this pandemic may be that we rethink a lot of our institutions, the way we do things. Schools have been shut down, both K-12 and colleges, and it's forced a lot of people into either homeschooling in the case of K-12 or computer-based, Zoom-based classes in the case of colleges. There are a lot of us, including me, that thinks a whole lot of education ought to already be happening that way. Do you see any cracks in the fissures of the education establishment to open up the way we teach our kids to this technology?
Certainly online learning and expanding digital learning has taken off in several states, and removing barriers to that as best we can. You know, after the Black Plague, a renaissance occurred. And I think we have this opportunity in education reform, especially with online learning. And Lawson, you were going to say something?
No, I was just going to say, I think there are a lot of parents out there who are, perhaps paying a bit more attention to their children, what their children are studying and how their children are studying in good and bad ways, recognizing their own strengths as educators or not. And that kind of experiential knowledge is ultimately going to put more pressure to bear on the educational system, public, private, independent, whatever it might be, in a productive way. Because the teachers that have really risen to the surface here have come up with some creative ways of engaging with the kids when there's not actually a physical ability to assess. Some parents are seeing that in a very positive way. Some are perhaps seeing how their institutions are failing them, and it's going to force a different conversation that ultimately I think will change in the same way air travel is going to change. All of a sudden, do I need to get on an airplane to fly to go visit that person when we actually got a pretty good conversation going through Zoom? That's going to affect that kind of activity as well as how many of us are going to keep our offices, how many are not. There's going to be a lot of those Renaissance kinds of things that develop to sort of be the silver lining. But I do see education as being a significant opportunity to break and crack some really calcified problems that we've had for 30, 40 years.
Well, here's why you know it's an opportunity. Both Oregon and Michigan more recently, I think Michigan banned homeschooling as part of their because they don't, the fear is that people would get used to it, people get used to Khan Academy or the other kinds of online sources of teaching and find it's a superior product. And maybe they're going to think differently about putting their tax dollars into some of the public school programs, which particularly in the inner city haven't been working. Thoughts?
Organizations that are focused very effectively on content and content development do very
Correct.
Okay, well, I can see where I want you to steer your growth and resilience money. I think education for me is ground zero, and if we could do something to clear away the cobwebs and do something fresh that'd be exciting for me.
Right here, Bill. That focus.
Right.
Well, I know. Wait a second. I'm going to get my pocket picked in the middle of this call.
Yeah. Well, it is a big part of our future for sure.
It is.
And if you want to help, Bill, we welcome it.
Yeah. Well, yeah. I probably will. By the way, just to add, I use DonorsTrust to help me out with some of the charitable giving we do, and it's a fantastic operation where you can basically just go on the website and decide who you want to support, and they take everything from there. So I thank you for that. One of the other things about in this contrast to what we're dealing with now with the response from governments is that I think you've got some rules about supporting organizations that take too much money from the government.
We do. I think one of the distinguishing characteristics of DonorsTrust as a donor advised fund is that we are focused specifically on supporting organizations that do not rely on government money to affect their mission. And that their mission is also something that does not expand the size and scope of government. That obviously includes a lot of policy organizations, but it also includes the church, synagogue, and the small, local orchestra that's not relying on local dollars. And that's the civil society piece that matters to us and why the policy piece matters explicitly.
We got a minute here to wrap up. Tracie, final thoughts?
Well, as Lawson started saying at the very beginning, that private voluntary solutions will really show America at its best, right? We've seen neighbor helping neighbor. This is where philanthropy and America at its best can step up and help really alleviate the suffering that's going on, get our economy going again, getting people back to work, and really moving on to a bigger, better, brighter future.
Lawson?
Hard to follow that, but I would say 30 years.
Brilliant.
30 years of dealing with sort of policy in Washington, D.C. and the philanthropic world. This is a very, very unique situation we are in. And I am more optimistic about that Overton window possibility And that's going to require some effort and some strategic thought and some dollars to do so. But I think it's well worth it.
Well, thank you, guys. Lawson Bader, CEO of the DonorsTrust, and Tracie Sharp, CEO of the State Policy Network. You can find Lawson at Lawson?
DonorsTrust.org.
Okay. Tracie?
It's spn.org. It's for State Policy Network.
Okay, terrific organizations. And if you want to support the Growth and Resilience Project, you can find that information on the DonorsTrust website. Well, thanks for joining us. It's a Bill Walton Show, another episode, and look forward to talking with you through this crisis and looking through to talking with you when it's over and the sun comes out and we're all free again. So thanks for listening, and talk soon.
Thanks for listening. Want more? Be sure to subscribe at thebillwaltonshow.com or on iTunes.